We see a world in where we can be a part of putting an end to diet-related disease. If you look at preventable chronic disease today, it accounts for 75% of all healthcare dollars spent, and we want to provide a lifestyle solution to that problem. I'm GB Pratt, founder and CEO of ModifyHealth. We use registered dietitians and medically tailored meals to help patients that are struggling with diet-related disease like type 2 diabetes. There's two major gaps in the healthcare system. One, most physicians are not experts in lifestyle medicine, and even if they do have that knowledge, our reimbursement structure is not set up for them to spend the time that it would take to help drive sustainable behavior change. But secondly, most patients do go home. They'll leave the doctor's office with information about their chronic disease and ways that they could manage it or potentially reverse it through dietary change. And so the gap isn't generally around the information, it's around execution. By the time you've seen a doctor, you've had symptoms that send you to the doctor, you've generally got 10, 20, 30, 40 years of built-in habits. And information alone or a self-directed app is not enough to help support behavior change. And so that's what we built at ModifyHealth, is a very simple but structured program that takes advantage of dietitians, lifestyle providers, medically tailored meals, so patients can see what good looks like, they can experience very fast results, and ultimately get long-term sustainable behavior change.
Since the timing's so important, when should I be eating?
Well, it depends on a couple of different factors. So let's talk about what your schedule typically looks like.
My name is Maddie Reeder. I am a registered dietitian by training, and I'm the VP of Clinical Operations. ModifyHealth takes more of a nutrition psychology approach. We look at the person for who they are, exactly as they are, and we meet them where they are at. It's really surprising how many people don't know what their diagnosis actually means and what they're supposed to do about it. So we give them the education, we give them the compassion that they often don't get in other places and spaces, and then we tie it with the food care as well. What these outcomes produce aren't just great A1C results, great blood sugars, and feeling better day to day. It's this confidence to go out into the world and share what you've learned to eat well and inspire others too.
ModifyHealth and Valley Health System partnered on a 12-week initiative focusing on patients with diabetes. We looked at patients with poorly controlled diabetes to try to understand how we could use food and nutritionist support to better control outcomes in this patient population. We know the literature shows that for every 1 point reduction in hemoglobin A1C, it's associated with, at minimum, a $1,200 per member per year savings. So we were really excited because 77% of our program participants actually saw a reduction in their A1C. But of those, 57% had a clinically meaningful reduction in their A1C, which is a 0.5 point or higher reduction. Why we care about that is because we know that that's where we start to see reductions in healthcare complications associated with diabetes and a reduction in spending and healthcare costs.
We see a world, I'm very confident there will be a day where doctors will be able to prescribe dietitian support, medically tailored meals, along with lifestyle programs, so that we can get to the root cause of these chronic conditions, ultimately lower healthcare costs, but greatly improve patient outcomes and longevity.